Okay, it is time for our weekly visit with Dr. Kevin Kavanagh. Dr. K is the founder and president of an organization called Health Watch USA. He's a retired physician. Morning, Dr. K.
Good morning, Jack.
How you doing this morning?
Doing really well. It's a little early where I'm at, but I'm still on Eastern time, so I'm up and ready to go.
Very good. Let's talk about what's going on in Kentucky. The positivity rate and cases are starting to increase. Walgreen positivity tracker, tell us about it.
Yes, cases are starting to tick up, and this is being primarily driven by the BQ variants. We've seen this happen in Europe. Europe had both a rise in cases and hospitalizations and a small rise in deaths. Unfortunately, we're not as well vaccinated as Europe, and no one's wearing masks, so we may get hit somewhat harder. So it is, unfortunately, not a good present for the holidays, and it's something we really do need to try to prepare for.
How are we gonna convince people to wear masks?
I don't know. It's going to be tough. And with the holidays coming on, Jack, that is a huge problem. It's a problem because of two reasons. One is you've got relatives coming in from out of town. They're traveling long ways. Many of them are elderly, and they're going into an in-home setting. And I can tell you that if you look at the ventilation of a home, they're kind of built airtight. The ventilation is not good. So it's really a venue that can transmit these viruses quite easily. I've got a CO2 monitor, a portable monitor, and I tend to monitor the CO2 levels at various venues, and this is a surrogate for circulation. And I can tell you the retail establishments, many are very good ventilation, but you get into a home setting, the CO2 is oftentimes over 1,000, and you want to have it around 700 or below. Outdoors, it's about 400. So at 1,000, that's really too high for fresh air. And this is where we're going to be celebrating our holidays. So there's several steps you can take to try to make this a bit safer. One is the pandemic emergency has been extended through January 2023, January 11th. And you can order free tests on your insurance. And so one good strategy is to test everybody right before the event. Do a rapid test. And there have been studies that show that this will decrease transmission by 40%. The other is to ask your relatives, say, hey, look, I know you're not really high risk for this disease as far as hospitalizations and deaths go, but we've got elderly people at these events. Maybe the week before being a little bit more careful, not going to high-risk venues, wearing a mask, etc. Because once you're in the event, for example, Thanksgiving dinner, in my household, dinner's not just one time period during the day. We kind of graze on the food throughout the entire day. So masking really isn't something that I think will practically work. Plus, you've got kids hugging grandparents, jumping up on laps, etc. The best strategy, I think, is to try to prevent this virus from getting into the household on the front end. And I think it's very important.
Talk about the breakthrough infections with this new bivalent.
Yeah, that is somewhat disturbing. As you know, the CDC director is currently having a rebound from COVID-19. People are getting long COVID. So even just because you're not in the hospital, if you get a breakthrough infection, that means you're still at risk for long COVID, and that can occur in up to a third of the people. The new bivalent was really hoped to be just a wonderful drug that would snuff out the infection. And some studies are showing it's probably no better than the original booster. Now, when I say that, that doesn't mean it's not good. The original booster does decrease disease, and it decreases hospitalizations. So it's still something to definitely get, but it's not this knockout drug that's going to prevent new infections entirely. And so that means that one still wants to be careful around others. You want to mask, you want to avoid indoor settings, especially as these rates are going up. Because, Jack, long COVID is becoming more and more of a problem. It commonly occurs with even mild disease, and too many people are not getting over this. They're getting sick and they're staying sick. A couple of months ago, I'd say they're staying sick for many months, But now there's studies out that if you have this virus for 6 months, you're likely to have the symptoms for a year and a half or more. So this is something you don't want to get. We need to avoid this disease.
All right. Another thing, this new control study from Israel. Can you talk about that?
Well, that's looking at long COVID. And what they found is 1 in 3 people are not returning to full health. Many times, mental fog is a problem. Myocarditis can also be a problem. Of course, on these type of studies, that would be represented as fatigue. And Jack, again, it's a problem. We're seeing study after study after study showing that 1 in 3 people are developing lasting symptoms. And this is not necessarily people that are in the ICU and hospital. This is even people that are out of the hospital and that have mild disease. If you could remember back in 2020, we talked about heart disease and the Big Ten college football players that were being told that they have to isolate because they were developing myocarditis on MRI scans. Everybody said, well, you're alarmist, you're alarmist. And we kept trying to stress that this is as much a heart as a respiratory disease. And now that this is starting to come about and the public's starting to become aware of it, people are saying, well, what's going on? Is it the vaccine? Is it COVID? Well, I hate to say this, it's COVID. We were talking about this well before the vaccine. The newest death that is gaining public attention is Julie Powell. She's the author of the novel Julia and Julia, and she had a cardiac death right after having COVID-19. And people are saying, well, could this be related? The answer is yes. Dr. Ali, very good researcher, spoke at our conference this year. He's from the VA, and he showed that myocarditis is 2 times as likely to occur within a year after having COVID-19. Cardiac arrhythmias are also very likely, along with other cardiac abnormalities. And of course, you've talked about blood clots, strokes, etc. So there are long-term consequences of this disease, even in people that are mildly infected. And none of that has to relate with the CNS or brain problems and brain fog, which, as you know, Jack, is a very common problem that people have when they develop this. So let's have a safe holiday, especially when we have indoor gatherings with elderly high-risk people, and take a few simple steps. Get your free COVID tests and get yourself vaccinated. Wear a mask and socially distance before the event so that you're not likely to take this virus into the family setting. And also get flu shots and try to avoid getting other diseases, because COVID is not the only thing which we are dealing with this winter.
Dr. Kevin Kavanagh, thank you, sir.
All right. Thank you, Jack.